So it's important to prep for your telemedicine appointment just because you can get the most out of it. So that's really important. Prepping involves, just making sure that your photo ID is handy, your insurance information is handy, you have a list of all your current medications, write down the questions that you may have for your provider ahead of time. If you have your book where you've been writing down your symptoms or your symptom diary, that's always good to have handy because then you can sort of tell the physician that, based on what you've documented, you feel you're either having more flares, less flares, just to give them a sort of a sense of idea of what's going on. So just make sure that your computer or an iPad or whatever screen interface you're using is fully charged, it's working, the software for the telemedicine visit has been downloaded and it's working appropriately. Make sure that you have a good internet connection which allows you to, conduct that telemedicine visit with your provider. The important thing is to sort of find a space that's quiet, it's free from any distractions. Given the fact that it's a sort of a two-dimensional interface where, we obviously as providers cannot examine our patients, especially examine their joints, it's super important to be in an area where there's adequate lighting so that I as a provider can see what's going on. If one has not done telemedicine visits before, or if they're not very tech savvy, it could seem like a daunting task. So it's always good to sort of prep beforehand. To be honest with you, there's really nothing to be nervous about. It's so convenient. It takes away from the commute of going to a physician's office. Certainly, if you're having active arthritis where it's painful to walk around, it takes away that and you can sort of talk to your doctor from the comforts of your own home.